Welcome to Self-Care for Caregivers, a wellness podcast series brought to you by HCA Healthcare. I'm Dr. Frank Drummond, National Medical Director for Behavioral Health Services.
This podcast may not contain all of the information on the covered topic that is important or relevant to you. You should not place undue reliance on the accuracy, fairness, or completeness of the information presented. This content should not be used as a substitute for independent clinical judgment. Anyone with questions or concerns about the covered topic should consult with their healthcare provider. This HCA Healthcare podcast is intended to inform providers on our hospital's medical staffs, our employees, and other interested parties.
Today we're going to discuss getting back to sleep during a pandemic. I'm Dr. Frank Drummond, the National Medical Director for Behavioral Health Services, and I have the pleasure of being joined by Dr. Misha Peter, the Medical Director for Methodist Sleep Labs in San Antonio. We're going to talk today about one of the biggest complaints that we are hearing from our colleagues. Everyone in the whole world has been experiencing the stress of a pandemic in their own way. And so everyone's stressors might differ a little bit on your family situation, your work situation, and what kind of job you do. However, one of the side effects that is most commonly noted are disturbed sleep during the past year. And so, Dr. Peter, I'm just curious, what are the most common complaints you've seen from patients or colleagues this past year? We'll say 2020.
2020 has no doubt been a tough year. I think apart from the daily stress of having our routines kind of upended and having to work around restrictions and demands on your time more so than what you normally would expect from a patient perspective. So let's look at this from two different things. From the healthcare professional perspective, we have folks who are struggling. So they have been seeing more sickness, more death than we've had to see in the prior years. And it's not been easy. We're trying to make sense of this. We're learning as we go along. And I think in terms of just the immense loss that we've seen, immense loss that we are dealing with every single day, that's going to cause stress. And again, when it comes down to manifestations of stress, I think sleep, the inability to sleep, the loss of sleep is probably going to be one of the big things that show up in everyone's lives. I think all of us have had those occasional panic attacks at night and sleepless nights, being worried about the virus and the infection and you bringing it home to your children or your spouse. I mean, those are all very real fears that people have had. And I think most of that has reflected in our inability to be able to sleep as well as we've had in the past. And I don't think that's uncommon. I think we have to be cognizant of the fact that this is a very normal human reaction to a very abnormal human state. I mean, this is not something that we expected to see in our generation. And then all of a sudden, the entire world is facing the same enemy, so to speak. So I do think being kind to ourselves, knowing that, it's okay to see this. It's okay to say, I can't sleep. I can't fall asleep. I am worried. I am worried about everything that's going on. So that's from a healthcare perspective, I think. And I'm sure you've seen this as well. From a patient perspective, again, that stress is very real, even if you're not personally involved in the healthcare field. If you're not personally related to someone who works in healthcare, you're still aware of what's happening in the world. And I think for a patient who has high risk factors, the fear of getting COVID-19 infection is always there in the back of their minds. That's going to cause a lot of stress and, again, insomnia and things like that. So I do think the driving factor here for everyone, understandably, has been fear of the unknown and in some cases fear of the known situation. But most people are complaining of more headaches, more insomnia. And again, this is the year we've had. So
right. And it's kind of ironically, people complain of feeling tired all the time, but then they can't sleep when it's time to sleep. It's been a real issue. And from a psychiatric perspective, it's a lot of the racing thoughts. It's the mind will not go into that sleep phase of, like you said, that it's important to relax and take your sleep seriously and get in a dark room. Your mind isn't working at that pace.
Exactly. And so let's look at the silver lining of this year. I think a lot of us have had time to get in touch with ourselves and to understand our limitations. And I do think that is a big factor in growth, to be able to say, hey, this is my limit. This is how I need to slow down. These are the things I need to do to make myself feel better. And I do think that a lot of my colleagues, have taken up meditation, and I think that's excellent because they're actually forcing themselves to slow down for a few minutes every day and saying, okay, I'm going to take that deep breath, right?
Right. We're going to do another podcast or interview to try and help people to start a meditation practice because
oh, excellent.
It's worth the effort, to your point. How's the pandemic affected you this past year? How has your life changed?
So, I mean, it's an interesting year, to say the least, and interesting is such a loaded word. I don't think any of us thought this would happen, and it's kind of been a little bit of a whirlwind. Now we look at it and we say, well, it's been almost a year since we saw our first patient, and here we are at the end of 12 months, and we are probably in a better place now than we were a year ago in terms of knowing how and what to do to deal with the pandemic. But in terms of mental stress, I think, it's expected. I think all of us kind of expect to feel the stress of the pandemic. I think we do the best we can. We say, okay, well, this is how, life has changed. What can you do to try and stick to a routine and try and make sure that the people around you, so especially, if it's not just about you, you also have to be cognizant of the fact that your spouse and your children, they're all kind of going through, the way the pandemic has changed your life. So I'm sure we've all kind of struggled with distance learning initially and, kids just wanting to go back to school and things like that. So it's been a little bit of a balance, but I think really at the end of the day, I'm a big believer in routine. And if I have to change my routine in an effective way to continue to be productive and keep my, my mental health and my mental balance as good as possible, then, I make those changes. And I think for the most part, it's one day at a time. So today is better than yesterday was. And we just keep moving forward.
Yeah, it was an interesting shift. So I'm a psychiatrist, and to move from being a psychiatrist literally within a week to being an infectious disease specialist was a really interesting shift for me. I never thought I would spend this much time thinking about, the management of a virus, the safe application of healthcare, given there's a very infectious virus, and trying to do the healthcare, the psychiatric or emergency part. It just was a very, very fast, almost whiplash for me, professionally. So, and I think as providers reflecting on the year, like you said, one of the biggest shocks was that no one felt good at what they did for a while. Like I wasn't an expert, and we were all looking for guidance that just wasn't there. It was being created, right, at the time. So,
and I think as medical professionals, at our stage in our careers, I think one of the things we always take for granted is that we have the answers, right?
Right.
And all of a sudden this virus comes along and we realize that despite the combined years of experience and the combined years of wisdom, we don't have all the answers. And, I do think that we have to be kind to ourselves because this is hopefully a once in a generation thing. But but again, I think it's that loss of control that very often drives a lot of that helplessness and that feeling of angst. And it's very easy to get overwhelmed, especially when you're seeing tens and hundreds of COVID patients every week and every month, and it just kind of goes on.
What are some other considerations? What do people need, like right now, in particular, to get better sleep in their life and to get some of that normalcy back? I mean, what are some other things?
Again, we've talked about this before, but I think that routine, being cognizant of the routine, really important.
Mm-hmm.
I do think it's also important to maintain human relationships and, just friendships, because all those little things we used to take for granted, right? So going out for dinner with friends or having people over, all of a sudden, all that came to a grinding halt. And then, we wonder why we're not sleeping well, because our lives have changed, absolutely. So any way that we can substitute those interactions. I have friends who've been really creative. I mean, I had a friend who's a physician. She's in Phoenix, Arizona, and she was pregnant during the pandemic. And we had a baby shower for her on Zoom. And again, just being able to reach out to people to kind of, stay in touch. I think all those things go to decreasing stress in general and improving sleep in general as well. Because when you decrease stress, at the end of the day, you can probably wind down better and go to sleep.
Now, I will say this past year, there's been an increase in the use of alcohol. I don't know, I think we should just be blunt about it or frank about it. What happens to your body when you drink at night? How does that affect your sleep cycle? And how do you advise people around drinking?
So this is somewhat of a loaded question. No pun intended, but I will tell you, people like to hear what they want to hear when I talk about alcohol. So I do want to kind of stress on the fact that everything in moderation, probably okay, right? But sometimes we're not honest with ourselves what moderation truly is. I think one of the biggest pitfalls of alcohol and alcoholic beverage intake is that it's very easy to go from every other day or every week to every day. It's very easy to go from 1 drink to 2 to 3 and, perhaps even more. So alcohol is recognized as a mild respiratory depressant, right? So when you're awake and you've had some alcohol, absolutely, it can cause some respiratory depression. It's something that is well known. Now, during sleep, when you actually go to sleep, it can actually exacerbate obstructive sleep apnea. So if you have risk factors for sleep apnea, it can make your sleep apnea worse. And if your sleep apnea isn't being treated, or if it's being treated at a certain level and you don't really have the luxury of, let's say, something like an auto-titrating CPAP, which adjusts for your breathing events, then a lot of times having alcohol can make sleep apnea worse. The way I always talk about alcohol is people look to it as a sleep aid, right? So they say, okay, so I'm going to have a drink, go to sleep, that kind of thing. Now, for someone who's not drinking regularly, you can probably say that, yes, it can cause to some degree cause some sleep induction. But I think the thing to remember here is that you can get tolerance to that beneficial effect like within as short as like 4 or 5 nights. So if you have a regular drink within less than a week of regular drinking, it's going to stop being a sleep-inducing agent. And then what ends up happening is, if let's say you're an insomniac and you're drinking alcohol, what's the next step? You're going to increase, because you're self-administering the dose. So the next reflexive step is going to be to increase it, thinking you can compensate. But again, like you said, exactly, it suppresses REM sleep. It causes something called rebound wakefulness. So people will wake up at 2 a.m. or 3 a.m. in the morning, those sudden awakenings, because by that time, the body's metabolized whatever alcohol you've had at 10 or 11 p.m. And then at 2 or 3 a.m., you're wide awake because the alcohol is out of the system. You're wide awake.
Right. And I know this is all loaded, like you said. If you're an alcoholic or haven't known, don't drink at all, right? There's a clear anxiety benefit to drinking. That's what people like. It makes you feel better. Like it reduces some anxiety, both social anxiety and generalized anxiety. During the pandemic, of course, that's why people are drawn to it, because it's one thing to make you feel better. But there's a definite downside. I think people should take a look at their patterns and what it is doing and it's not doing for them. And then maybe seek some other help or advice if it's really anxiety that is keeping you from sleeping, that the alcohol is the only thing that's helping. I've often taken the cytochrome induction piece of alcohol, like with medications. You can drink 2 drinks 2 times a week and not affect your Prozac levels, for example, your antidepressant levels, and just applied that broadly and told people, I think if you're not an alcoholic and you drink 2 drinks 2 times a week, it's not going to have a very negative impact on your health and life. That's just some of the ways I frame it, depending on the audience, right, or who I'm talking to. But
exactly,
it's been an interesting year to try and watch people do it and understand why, but then also say, please be careful. You're going to be tired the next day. You're not going to feel well. I mean, you might even be hungover, right? So I appreciate you being frank and honest about it. I think people need to just talk about it. I really do.
I agree with you. I mean, I think part of self-care is honesty. You have to be kind, but you also have to be honest. And whether that's when it comes to applying it to yourself or to someone you love or, someone you care about, you want to be kind, but you want to be honest. And you want to say, is this a problem? Is this something that we have to address? And do you need help? And I think really that's what it comes down to.
And it's not a long-term solution for sleep. Just
really
like sleep is
really
a long-term solution for sleep. What you don't build up tolerance for is meditation practice. You can meditate all day long, and that you never lose that benefit. Regular exercise, you never lose that benefit on sleep. I mean, I would like people to reframe the way they think of things that they do to help their sleep to things that actually have a positive impact and don't ever wear off.
And, I love what you said about meditation, right? The best thing about meditation, and you become better at it the more you do it. Whereas you can't really say that about some of the other choices that we make. But meditation is truly one of those things that you become better at. And the better you become at it, the more benefits you have.
So the more you do it, the easier it is, and the more you like it, and you become to depend on it in a good way. I find the same with routine exercise. If you find something you enjoy doing that doesn't stress you out, it becomes a part of your life that you anticipate and make time for and becomes a priority. So looking for those opportunities in your life versus, I guess you could get good at drinking, but it's not something you want to do, right? So
probably not recommended.
Just being frank about all the choices you make during the day, because they're very critical, because our self-care, a lot hinges on it.
Exactly. And I do think that tiny little steps, so, taking a couple of deep breaths, and really the physiological benefits of deep breathing, not to sound hippie about it, but at the end of the day, just stopping and taking that deep breath and inhaling and having a long exhalation, it stimulates the nervous system in exactly the right ways. And that's what you need.
Right. So there's a bit of mindfulness in there too. So mindfulness and meditation can be two actually different practices. We'll talk about it in another podcast also some more, because I think it's very, very interesting. Some people don't like to talk about maybe drinking or even sleeping pills or some other choices that they're making, but they will talk about sleep. I find in some cases, if you can just talk about sleep and say, why are you not getting the sleep that you need? And what can we do to get a better sleep? Talking about some of the things we've talked about today, it can be an intro actually to introducing other lifestyle changes. You can retrofit it. So they might not want to talk about their weight or exercise, but they'll talk about sleep. And if you introduce one of those key components is having regular exercise to having a better, more restful sleep, and trying to build the conversation in that way, does that make sense to you? I find that sometimes
it does.
People.
It does. And I will tell you that it's actually a very common practice of mine. For example, if I see a patient who has sleep apnea in my clinic, let's say it's someone who's naive to CPAP therapy and we're starting the person on it, I very often will frame it as this is a wake-up call, right, to start looking at better lifestyle choices and start looking at it in terms of what can I do to make myself healthier in the next 12 to 18 months. I think when you start framing it as little steps, a little exercise every day, making sure you put your phone away and put that CPAP on, and you go to bed and get those 7-9 hours of sleep. But telling people that trying to get better sleep and exercise more there so that you can become healthier in the long run is important. And I think the way we frame that, the choice of words is important. Again, with the same goal in place, which is, becoming healthier in the long run.
Very interesting. Well, this was a great talk. Thank you so much for your time.
Thank you, Dr. Drummond. It was a pleasure.
I really love the work that you're doing in Texas, and you're doing this with us today is going to help a lot of people, I think, make that pivot into a new normal. So thank you so much for your time, and I wish you all the best and be safe.
Thank you, sir. It was a pleasure. Thank you for having me.